The Nigeria Center for Disease Control says its Incident Coordination Center is now in alert mode, as well as other measures to prevent the potential outbreak of the Sudan strain of the Ebola virus detected in Uganda in September this year. The agency says this is due to the large volume of air travels between Nigeria and Uganda and the interactions among such passengers, especially at the regional travel hubs of Nairobi, Addis Ababa and Kigali airports. The agency is stressing that there is the additional risk of importing the disease from other neighboring countries that share direct borders with Uganda, should cases arise in other countries in the region. Well, joining us live in the studio to help make sense of the country's preparedness and measures against the ongoing Ebola outbreak in Uganda, as mentioned, is the Director General of the Nigeria Center for Disease Control, Dr. Ifedayo Adetifa. Thank you so much for coming on the news.
Thank you for
Good to see you again.
You said we're in alert mode, but what exactly are the measures in place to keep Ebola out, or at least prepare better than we did in 2014?
Okay, it's a good question. So at the moment, we are worried or in the mode to hopefully prevent or to be successful at preventing the importation of a case of Ebola. And that starts from increasing awareness at points of entry. At the moment, we are keeping track of all passengers that are returning from the country with history of travel to Uganda, generating line lists from the airport, passing them on to the states where that are listed as their final destinations, and there are people both at state and national level that are calling them up every day for 21 days to find out if they develop any symptoms. We are, of course, intending to train or to provide refresher training for everybody, port health staff, people at the airport, anybody that may have the opportunity or chance of coming into contact with a potentially infected patient, with a view of making sure that we increase the chance that an imported case will come across people who know what to do versus sort of panic mode. And we have not seen a case since the last incident. So between attrition and people forgetting about things, people don't really know what they should be doing. In addition, we've identified laboratories that would test suspects should that happen. So we've always had capacity to test both at our reference lab in Abuja and in the lab in Luth in Lagos, regardless of whether there was an outbreak in Uganda or not. And right now we're just making sure that we're prepositioning additional test materials in case we need to test in a few more labs. The other thing we've done is to, of course, we're prioritizing all the states with airports and 2 land crossings for training of the staff, for assessments of which hospitals or isolation centers cases we go, and for training of the healthcare workers that may encounter this case.
All right, so NCDC, Nigeria Center for Disease Control, of course, your agency, issued an advisory days ago. Help us understand the risk level that Nigeria faces. We need you to underscore that. And how different is this Sudan strain, the EVD in Uganda, different from what we saw, experienced in 2014 that led to the deaths of 8 people in Nigeria?
So when we move to a level of alertness, it means that we are now, that requires corresponding actions to either respond to something or to, in this case, increase efforts at preparedness to prevent an event from happening. And because we have assessed in a joint risk assessment, not just by the NCDC, but with all other relevant stakeholders involved, the results of a joint risk assessment suggest that we are at high risk should there be importation of a case for, of course, some of the reasons that have been highlighted. And this means, therefore, that we have to take these additional steps of preparedness, already tracking persons of interest who return from Uganda, already setting up PHEOCs in these 8 target states to prepare, already doing assessments for potential places where patients will be looked after, and all the training, even hiring of additional such staff for port health that might be required to deal with cases coming into the country. So that's what the level of alertness means. Now, in terms of the Ebola virus has got 5 different strains, and we are used to the Zaire strain, which is what led to the West African outbreak, including the one that affected Nigeria. The Sudan Ebola virus strain is different from that strain. It was first identified in South Sudan, I think, in about 1976, and so far has caused 7 outbreaks. I think 4 in South Sudan itself and 3 in Uganda. The key difference between it and the Zaire strain, which also contributes to our assessment of high risk, is that the current Ebola vaccine does not have an effect on that strain. Okay, so whereas we've got an effective vaccine that can be deployed in ring vaccination, should there be an outbreak with the Zaire strain, we do not have that particular countermeasure this time, should there be an imported case. And sadly, our colleagues in Uganda don't have access to that. Otherwise, like their colleagues in the DRC, they would have vaccinated all these rings of contacts around the index cases and hopefully moved closer to actually bringing the outbreak under control compared to the situation we currently have.
So is it let me just put this in. I mean, is it that the vaccine for this EVD is not available anywhere, or that there's just no access yet? And are there preparations at all?
So Ebola, EVD stands for Ebola virus disease.
Yes.
Okay, it can be caused by any of the strains of the Ebola virus.
Right.
Now, the only vaccine that we have for Ebola virus was developed against the Zaire strain. This is the Sudan strain. Okay. That vaccine does not have an effect on this particular strain of virus. In fact, WHO and partners are working to see if they can quickly ramp up trials of candidate vaccines for this for possible effect against this particular strain.
Well, it almost makes sense knowing that the Zaire strain is one of the oldest strain, if not the first strain of the disease. But I wanted to ask you, what sort of strain does this put on your agency and your workforce? Because with flooding, we have cholera on the rise. We have Lassa fever, which is all year round, almost all year round these days. You have, of course, this Ebola threat and many other outbreaks. So what sort of strain does it put on your agency?
Quite a bit, really, and not just us, but everybody who has a stake in national health security. And sometimes we do, feel a bit like we're stretched out paper thin, but we have to deal with this as usual. I would rather that we don't have to deal with a single case of Ebola.
I almost forgot COVID.
Than to deal with a case, but we are getting on with it. We are trying to, what we need is to really move quickly and not necessarily wait till everything is perfect. And we are getting on it.
What are those specific things that you need to be on the table to ramp up your capacity to?
Well, at the moment, the
effort is it what?
Well, effort is geared at the moment towards prevention of a case coming into the country or prompt identification of a case coming into the country, which means that we've got to do quite a bit in port health services. These are our colleagues in the Ministry of Health who man the airports and provide screening or implement whatever control measures are there to identify or prevent.
I was at the airport last week and no one is checking temperatures anymore. I wonder what measures are being put in place in port health. And just talk about the difference between the two strains. Are the symptoms different?
No.
So why don't we have people checking for temperatures and the rest at the airports?
So symptoms are the same. One of the reasons why we recognize there's a need to train everybody at the airport now, because yes, I am hearing variable stories. I did pass through the airport myself.
Well, did they check your temperature?
My temperature was checked.
But when was this?
I came in last week, so temperature was checked. But you are to an extent correct, because I am getting mixed reports. That is, it should be done consistently and for everybody. And I think, which is why we need this training that I just signed off on today, to make sure that people understand the urgency and shake off the COVID You know, everybody's fatigued.
We're all tired. What's your advice to Nigerians? What do we need to do to protect ourselves?
I think it's important what the advisory says. Nothing but essential travel to Uganda. In fact, I would qualify that to say, if you do not have to go to Uganda, don't go. If you have to go, I prefer you don't. Okay?
It's that bad.
Still don't go.
Still don't go.
So we'll have to leave it there. Thank you very much. If you don't have to go to Uganda, please don't. Dr. Ifedayo Adetifa, NCDC DG, thank you very much for joining us on Newsnight tonight.
Thank you for having me.